Breast cancer is the most common malignancy diagnosed in U.S. women after skin cancers, and it stands at the second position next to lung cancer in mortality index. About 252,710 fresh invasive breast cancer cases and 40,610 breast cancer deaths were anticipated among U.S. women in 2017. In Saudi Arabia, breast cancer is the most common cancer in women. According to the last report of the Saudi Health Council on the incidence of cancers, breast cancer accounted for 29% of all cancers in females in 2013. In general, breast cancer is referred as a single disease, but there are at least 21 diverse histological subtypes. This owes to the complexity of disease and its treatment. Nevertheless, current treatments for breast cancer include chemotherapy, radiotherapy, immune suppression, excision surgery, and endocrine therapy. However, reoccurrence of disease and severe side effects of most of the chemicals and radiations used for these therapies are exigent in breast cancer patients. Also, in estrogen receptor positive, ER+VE, breast cancer patients aged less than 40 years, the role of chemotherapy is not effective. Therefore, to improve the chemotherapy options, there is always a scope for safe and efficacious alternative therapeutic agents. Since time immemorial, medicinal plants provide humanity with novel therapeutic remedies for innumerable diseases. For instance, vincristine, vinblastine, and paclitaxel are FDA-approved breast cancer drugs of plant origin. One such native Mediterranean herb, Foeniculum vulgare mill, is also a potent source of bioactive molecules. Foeniculum vulgare, Fennel, is a biennial aromatic medicinal plant from the Apiaceae, Umbelliferaceae, family, which have been used as a spice in traditional medicine worldwide. It is known by the different vernacular names such as fennel in English, in Arabic bisbaz and razianage, in France fenouil, in Loja, Ecuador hinojo, in the Indian subcontinent Sanuf. The objective of our current research was to demonstrate the anti-proliferative and apoptotic effect of chloroform fraction of fennel, CFF, in MCF7 cells. Anti-proliferative assay, MTT assay, and colony formation assay were performed to study the growth inhibitory effect of CFF. Various morphological changes of apoptosis were observed using Giemsa, Hirscht, and acridine orange, ethidium bromide stains in MCF7 cells. The extent of apoptosis and cell cycle arrest was measured by flow cytometer. Levels of ROS and mitochondrial membrane potential was measured by DCF-HDA and JC1 respectively. Caspases' activity was measured by luminescence and DNA fragmentation by COMET assay. CFF appeared as a good inhibitor of growth against MCF7 and MDAMB237 in time and concentration-dependent manners. All the morphological changes of apoptosis were evident in treatment groups. An X and V pi assay of apoptosis gave around 49% of apoptotic cells upon treatment of 0.5 mg per milliliter of CFF, and pi stain cells showed the G1 phase cell cycle arrest. Elevated levels of ROS, disrupted mitochondrial membrane, increased levels of caspases 9 and caspases 3, and DNA fragmentation were noted in treated MCF7 cells. In conclusion, our findings revealed the proliferation inhibition, cell cycle arrest, and apoptosis induction effect of CFF, which may help in exploring the novel anti-cancer drug for therapeutic implications. For more details, refer to our research paper Chloroform fraction of Foeniculum vulgare induced ROS-mediated, mitochondria caspases-dependent apoptotic pathway in MCF7, human breast cancer cell line. Thanks for watching.